So, welcome everybody to today's edition of CESI Talks. Today, we are with Radan Kanev from Bulgaria, member of the European Parliament, member of the EPP, and of course, for us, very important member of the Committee on Employment and Social Affairs. Mr. Kanev, welcome to today's sessions. We've had a session already in March. It was very nice and interesting. And I remember at the time we had this it was about the implementation, so the action plan here also on the implementation of the European Pillar of Social Rights. We were just expecting also the conference in Porto. Mr. Kanev, what do you think has happened according to you? What has happened since then with the pillar? In which camp does the ball lie now, according to you? What has to be done in the very near future?
Yes, after our previous discussion and the Porto Summit, what I can judge from my experience at work is that both the social politics generally and the social pillar became much more important in the work of the European Parliament, and not only the EMPL committee, but generally in the work of the European Parliament. And if before the question was whether the pillar should be horizontally implemented in European policies, or if it should be, or it should just stay a voluntary framework, now the question isn't if, but it is how. And the differences are on the how and not on the if. Still important differences, however, but it's on the implementation.
And what are for you now the next immediate steps which should be taken, or the most urgent steps which should be taken?
In my opinion and in my working perspective now, the most important thing is to adapt both our legislation and our goals. For example, and essentially, the implementation of the Pillar of Social Rights into policy and legislation to adapt it to the new working models of the 21st century. Not to search a conflict between digital models of work and social policy, but to find the way that they can go hand in hand. Because I see many colleagues, of course, good-hearted and good-minded, who are obviously trying to impose 19th century trade union paradigm over 21st century digital world, and this won't work. This won't achieve the goals.
Mr. Kanev, you also you have been focusing on the right to health, one of the principles also enshrined in the pillar. What is your assessment now? We can look back to a year and a half, maybe a little bit more, also fighting against the pandemic. What is your assessment of the EU to protect citizens and workers and offer them high performing health services during the pandemic?
I don't think it's only during the pandemic, because overall Europe, basically the healthcare regarding COVID-19 was universal. It was not related to health insurance at work. Big problems arose, of course, for people who are temporarily engaged in work in another country, and after their contract was terminated, sometimes due to COVID, they were left without any health coverage. This was a specific case, but generally, I think, and I will reiterate on the new models of work, what is extremely important is to guarantee that every working person in Europe has social insurance, never mind whether this person is working temporarily, part-time, or part-time for several employers, or partly as an unemployed and partly as part-time worker on the employment contract. All these hybrid combinations should not be used as an excuse for not having health coverage, because this is the case in many, many countries now. Both poor countries and rich countries have the same problem.
Mr. Kanev, you've also been involved in amending the regulation on the establishment of the European Centre for Disease Prevention and Control, the ECDPC. What will change, or what is supposed to change with this agency or with this centre?
Yes, I was the shadow rapporteur on behalf of EPP on this file. The changes are rather significant. Some of them are uncontroversial. Some of them will be subject to heavy trialogues. We start next Monday, exactly, in 1 week with the trialogues. One of the very important amendments that I proposed and many colleagues supported was the inclusion of non-communicable diseases when related as comorbidity and comortality to infectious diseases in the mandate of the center. I see that both the Commission and quite a number of member states do not agree. So this will be subject to very serious negotiations, because I think that COVID revealed so many interconnections, and I would say bilateral interconnections between infectious and non-infectious disease, that if we don't study the major non-communicable disease in their interconnection with viral diseases or infection diseases, the mandate of the center will not be really quite functional. But this will be a matter of negotiations. Otherwise, I would point out this health task force, which is uncontroversial, so everyone supported it. The scope of it, maybe whether it's ad hoc or it's a permanent body, this will be subject to negotiations, but we will have a pan-European health task force ready to go on field and assist any country in which there is a serious health problem.
Mr. Kanev, you just came back from Strasbourg last week. What is your overall impression of, as an MEP, of the situation the EU is currently in?
Oh, it's a very, very broad question, but obviously we are in a difficult situation. We see economic recovery in most countries, with quite a pace with some of them, but not all of them. On the other hand, we see the overall debt rising, and most importantly, we see this inflation wave, which is troubling everyone, because obviously our incomes are not anymore what they were last year. The prices, especially energy, but food and many commodities, construction, housing. This is a huge range of new problems that we need to face, and we need to prepare for very serious political decisions, because just taking new debt for covering the bigger expenses and pumping new inflation this way will not do. We need a wiser economic policy, both on national and European level.
Mr. Kanev, all the best to you. I hope we meet in person very soon in the European Parliament in our premises, and a lot of success for the coming months. Thank you very much.
Thank you very much. Thank you.